First, I have the great honor to invite Honorable Kim Se-yoon, Chair, Health and Welfare Committee, President, Korean Parliamentary Forum on Global Health, and the National Assembly of the Republic of Korea to have the presentation and the views. Yes, Honorable Singh, the floor is yours.
Yes. My name is Se-young Kim, Chairman of the National Assembly's Health and Welfare Committee, and also Chairman of the Parliamentarian Forum on Global Health in Korea. It is my pleasure to share our experience with APPFGH member states, and I'd like to thank APPFGH Chairman Keizo Takemi and Secretary General Takeshi Kasai, and also Dr. Ham and other WHO WIPRO staff members, and Dr. Ryo Yoon-go for your wonderful moderation. I will present in three parts of our country's perspective. The first one is the situation update in Korea. Fortunately, Korea's response to the COVID-19 pandemic has come to be regarded as successful. Without implementing a full border shutdown or strict restrictions on economic activity, the number of confirmed daily cases of coronavirus in Korea has now decreased to single digits, and country's fertility rate is very low in comparison to that of other countries. It can be said that Korea's COVID-19 response policies were implemented successfully because, first, the central government determined the direction of national policies. The second, local governments, private and public medical institutions carried out these policies to serve the public. And third, private companies succeeded in mass production of diagnosis kits in a very short period of time. And fourth, beneficiaries of these policies, the general public as well as those subject to isolation and quarantine, all work together to fight the spread of COVID-19. We learned that these lessons the tough way. Back in 2015, 38 Koreans died due to the MERS epidemic. These deaths were entirely preventable. After reflecting bitterly on this, the Korean government laid the groundwork for today's response to COVID-19 pandemic. For the second part, I will explain the legislative achievement. First, let's take a look at the legislation produced by the Korean National Assembly regarding the prevention of infectious epidemics. In February 2020, the National Assembly convened in a provisional session in order to review and revise laws relevant to the work of the Central Disaster and Safety Countermeasures Headquarters, which could allow for an effective and rapid response to the COVID-19 crisis. Three laws of which the National Assembly passed the amendment are, first, the Infectious Disease Control and Prevention Act, the second, the Quarantine Act, and the third, Medical Service Act. First, the amendments of the Infectious Disease Control and Prevention Act are the prompt disclosure of the extensive contact tracing, includes the information of medical utilization, travel route, and immigration records. The chairperson of the Infectious Disease Control Committee is the KCDC director instead of the Vice Minister of Health and Welfare. The number of the epidemiological intelligence service officers increased by 100 from 30. The mutual cooperation with local governments and educational institutions is strengthened to prevent the spread of COVID-19. By providing paid leave, patients during isolation and hospitalization can commit to the treatment and prevention without financial concerns. The health facilities and health professionals who treat infectious disease can be compensated for the loss. Second, the Quarantine Act states that the Korea quarantine plan will be established every 5 years. Notably includes the right to know the compensation measures for loss incurred by COVID-19, the duty to cooperate with government bodies and measures. Adds the people who transfer or are exposed to the areas at risk of infectious diseases to the list for prohibition or suspension of entry into or departure from Korea. Third, the Medical Service Act enables the patient clinical information available for epidemiological investigation, establishes the infectious disease surveillance system for medical monitoring to investigate the cause of an infectious disease. And I will explain the solidarity part. The Infectious Disease Prevention and Management Act was revised to enable necessary measures such as the provision of masks to vulnerable groups. After market failure made government distribution of masks necessary, legislative measures were taken to ensure that elderly, pregnant, and disabled people were not excluded from purchasing masks. However, there are still some marginalized groups within Korean society that are not considered for by COVID-19 response measures. For example, disabled people, undocumented immigrant workers, marriage migrant women, and foreign citizens were initially excluded from purchasing masks and had limited access to quarantine information. In the future, policy considerations must be made for these vulnerable groups with limited access to personal protective equipment. Korea also actively seeks partnerships with WHO and other international organizations and global civil society to end COVID-19 pandemic. According to a survey released just yesterday, 67.5% of Koreans said they are in favor of the government's plan to support foreign countries with protective masks. This survey results indicates that the Korean people agree that international cooperation is the right way to combat COVID-19. Moreover, Korea has thus far received requests from about 40 countries around the world to share knowledge on all matters relating to COVID-19 response, including quarantine and prevention, self-isolation, diagnostic testing, and treatment. In response, the government is planning to establish an International Quarantine Cooperation General Task Force in order to share Korea's experience with international partners. We in the Korean National Assembly are also helping to share our country's experience with COVID-19 prevention. In particular, we will cooperate with WHO, WPRO, and the APPF-GH members in order to combat COVID-19 in the Asia-Pacific region. In concluding my remarks, the global COVID-19 pandemic proves to us that health security is not determined by the low politics of health policies, but rather by the high politics covering a wide range of fields from genetic engineering to health policy to macroeconomic policy. We also learn how the parliamentarians can act as a catalyst for the nation, not only demonstrating leadership in disaster response, but also providing simple administrative services. We hope that APPF-GH member states will rise up to be leaders of this unprecedented disaster response and helping to bring a swift end to the COVID-19 pandemic. Thank you for your listening.
Thank you so much, Honorable Chair, Mr. Kim, to share the Korean experience and the good practice. And next,